My name is Shirley Kern, and I'm an oncology clinical nurse specialist at North Memorial Cancer Center and Hospital. And Gilda's Club, Annie, has asked me to speak tonight on making treatment decisions. So I just want to welcome everybody tonight. Thank you so much for joining us on this Zoom meeting. The last presentation I gave at Gilda's Club was last year in person, of course, and so this is a different experience. And so I'm so glad that all of you can join us tonight. If you do have questions along the way, I am actually okay with you unmuting yourself for a little bit if you do have questions that come up. Otherwise, we can do the questions at the end too, which is absolutely fine. And so I'm going to go through these slides, but as things come up, write some questions down, or if you have things to add, just know that it's pretty informal. So I do want you to participate if you would like to. So next slide, please, Annie. All right, tonight what the overview is we're going to do introductions, which of course we just did. We're going to be talking about treatment planning basics, choosing your treatment team, setting some goals, guidelines, pathways, treatment options, caregiving, and questions and answers. Now, I'm not really sure who the audience is, so I don't know if some of you, well, I know some of you, but some of you are already quite well underway with your treatments, and I think some of you could probably give this talk yourselves too, but because you have a lot of expertise as well. So I'm not sure exactly who the audience is, but I do want you to know that we will, talk through things. And if you do have questions, I just want you to bring those up. Next slide, please. Thank you. I also wanted to let you know that the following slides were updated by an outside resource. So these slides are actually put together by the Cancer Support Community, which is through Gilda's Club. And so these are reviewed by a psychosocial expert and a medical physician. And so these slides actually I did not put together myself, but I do look at the slides and then I kind of use these slides as a discussion point. So these are outside reviewed. Next slide. I also do want to acknowledge, oh yeah, that's fine. I also want to acknowledge that, I also want to acknowledge that this is generously sponsored by Pfizer Oncology. I do not have any affiliation with Pfizer Oncology, nor am I paid by Pfizer Oncology, nor am I paid by Gilda's Club. So I do want you to know that I have no financial disclosures or affiliations. So this is strictly a volunteer opportunity, which I'm very happy to do. So we do want to make sure that you are aware of that too. Next slide. And next slide. Okay, so what are our objectives tonight? Well, we want to learn how to recognize your treatment needs and how to respond to those needs. We want to be knowledgeable about your diagnosis and your treatment options, and we want to learn how to build your support system, ask questions and advocate for what you need, and also discuss some information for caregivers and making treatment decisions and making choices that are right for you. These slides are basically a launching pad really to talk about further discussion or questions or ideas or answers. So again, these slides give kind of the basics, but certainly there is so much more to this. So we can really, again, it's just a launching pad and we can go from there. Next slide. So how does this all begin? Where do you begin with all of this? So you or your loved one may have been diagnosed with cancer, but I really want to stress that cancer itself does not define you. I always tell patients that when they are first coming to our cancer center, cancer isn't all who you are. There's so much more to people. There's a whole life beyond cancer. And it's really important to remember that as you're going through your cancer treatments and making decisions along the way, because there's so much that makes contributes to making your decisions about treatments and what you want and what your goals are. So some of the most important things are to educate yourself, which of course is partly what you're doing tonight by coming to an outside talk through Gilda's Club. There are ways to educate yourself through the internet and by books and different things, different resources. It's also important to get support, and that may be through organizations like Gilda's Club or other organizations in town or your cancer center itself. One of the most important things that I often tell patients throughout all of this is no matter what stage you are or what the diagnosis is, always try to maintain hope and courage, because hope will really get you through each decision-making point and really help you along the way. So hope and courage, I really do want to stress, is a very, very important part of all of this as well. Next slide. So we talk about treatment planning basics, and there are some areas that will affect your decisions regarding treatment. Now, of course, a lot of these topics right here will naturally unfold when you're talking with your medical oncologist, so you don't necessarily have to go down the checklist, because a lot of these things will unfold as you're talking to your medical oncologist. But these are some points that actually really do affect how you want to do treatment, or how you decide to do your treatment. Maybe your age is a factor. Are you 50 years old or are you 85 years old? What's your point in life? Are you still raising little kids? Are you retired? Do you have family at home? What's your work situation? Are you still trying to work full time? What's your overall health? Do you have comorbidities? Do you have heart disease or diabetes or neurological issues? What are the things that contribute to your overall health? And what are your expectations? Are you there are different values that you might have that we're going to be talking about in a little bit, but what kind of things are you expecting out of treatment? What is your goal of treatment? Also, what is your available resource and support system? So do you have people who can drive you to your appointments? Are there people who can help with housework or house cleaning? There are a lot of things that go into the logistics of when you are undergoing treatment, how you are able to manage treatment and all that means with your treatment. And so a lot of times we say, who is there to support you? Who are your people? Some people are concerned about cost of treatment, whether it be they're concerned about co-pays or financial stress in terms of paying other bills. A lot of times we do talk about the resources, the financial resources that we can have from organizations, or maybe a financial counselor at the cancer center who can help with concerns about that. And you may have additional questions that pop up in terms of how different things in your life or different topics and situations are affecting your treatment decisions. So all of this goes into the treatment planning phase. And again, a lot of this will naturally unfold as you do talk to your medical oncologist, and you don't necessarily have to go through a checklist, because it is part of that discussion. Next slide. We talk about empowerment. How can people feel empowered? It's really important that people do participate in the discussion, and the nurses and the physicians want you to participate in the discussion. We want to know what your goals are, and are there strategies for your goals, and what kind of resources do you have, and what kind of resources do you need? We want you to ask for help. We don't want you to go it alone, because we are there to help, and a lot of times people do have family and friends to help. And so feeling empowered is a very important part of this as you are making treatment decisions. Next slide. We also talk about shared decision-making, and what does that mean? Well, shared decision-making is basically what can we do to make that relationship with your medical team even better, so that you feel a part of that treatment decision-making process. It's important that you and your healthcare team are talking about your values, your goals, your current living situation, so whatever treatment that we recommend, it aligns with those goals. And so a shared decision-making process is all part of feeling empowered and making sure that you do participate in it. It is a dynamic discussion with your oncologist and with your medical team. And so we don't want it to be one way. We definitely want you to make your needs known, and we want you to feel comfortable with your medical team. So that's a very important part of shared decision making. Next slide. We also talk about setting your goals. Well, what exactly does that mean? Well, a lot of people have, kind of personal goals. There are things that are affecting what their treatment decisions are. We talk about physical and emotional, sexual health and well-being. What's the most important thing for you to be able to do? Is it that you are wanting to make sure that you are still really active. Are you a really active person? Or maybe your family and social relationships, what's going on in the lives of your family? Maybe you want to make it to a certain wedding or the birth of a baby or a graduation. So what are these things that are really important to you? I had a patient several years ago who, when we first met her, she said her most important goals were she had 2 daughters getting married that year, and it was super important to her that she make it to her daughter's weddings, which she did. But it was important for us to know that from the very beginning, because then we knew what was really important to her and how we could manage things and help her make decisions along the way. Sometimes there are work or school or home type of goals. So do you want to continue working? Do you need to take a short-term disability or some type of leave? Are you able to adjust your schedule or have flexibility with your schedule? What are your responsibilities with kids or with home situations, or are you a caregiver of others? Sometimes we've had patients who they say, you know, I have to be as well as possible because I am the primary caregiver for my spouse who has a certain health condition. And so it's been really important for people to really share with us what is their goal and what is their particular situation so that we know how to base decisions and how we work with them. Next slide. We also talk about community involvement. Are you part of a certain community? Are you part of a church community or a community organization? And what's important to you? Are you still wanting to be a part of that? Is that what provides support to you? Maybe you have some personal and spiritual growth type of goals. Are you focusing on spirituality or meditation, prayer, meditation? There's so many pieces that add to those personal goals and things to think about along the way. There might be other things that are really important to you. I have a patient right now who told me just recently, she said, I want to do everything I can with my metastatic cancer. I want to do all of the treatment I can. I want to be as well as I possibly can be, because she takes care of her 27-year-old disabled son and she is a single parent. And so it's important for us to know that so that we too can maybe help her with other resources and make sure that she gets what she needs along the way. Next slide. We also talk about understanding your values. And what does that mean? Well, some things that may be important to you. Maybe you value being active with your family. You want to still go on trips and you want to be active with doing whatever they're doing, or I value being healthy to attend such and such, or I value having few side effects. I've had patients come into the cancer center from the very beginning and say, I don't want to lose my hair. Whatever we do, I don't want to lose my hair. And so, there are some chemotherapy drugs that of course do cause side effects such as losing your hair. And so sometimes we have to adjust those things based on what is most important to a patient. And we have to really acknowledge that these things are important to patients and honor that with patients. And maybe some people want to be a part of a clinical trial. They value being part of a clinical trial. So we take all of these pieces and we really try to put that into our treatment plans. And we want the overall arching goal of treatment to align with somebody's values and goals. Next slide. So along the way, there are going to be a lot of decision points. I think what's really important is it's important to understand the bigger picture, but it's also important not to get ahead of yourself, because sometimes people come in on that first time of meeting us and we're talking about the cancer diagnosis itself, we're talking about the treatment, and it's just completely overwhelming. And so it's really important for people to truly break the process into smaller bites, really take one step at a time, one day at a time. Sometimes it's 1 minute at a time, because sometimes it can be really overwhelming to take too much in at some point. And so it's important that you kind of break it into smaller bites so that you can understand things and also take it as it comes. And it's also important for you to locate yourself in this process, meaning think about what is your situation. You don't have to compare yourself to others, because each person is an individual, and what's important to you is what's important to you. And so it doesn't matter how the other person did or is doing with their treatment with a similar situation. It's important that what is working for you is based on what you want to happen. And so I can't stress that enough, is to think about your own goals, your own life, your own current situation, because everybody's in a unique type of situation. The other thing that we really encourage is to work with your doctor about having a treatment plan that's written down. So a lot of our oncologists, especially the first time you meet the oncologist, will actually write the treatment plan down or have some sort of written plan to give to you when you leave that clinic visit. So I think it's really helpful for people to have something written so that they can take a look at it, so that when they go home, they can kind of reflect on it. And even if they took notes on that treatment plan, whatever it may be, they can review it basically. And so that is an important, helpful tip. Next slide. We also talk about understanding your diagnosis. So one of the most important things, I think, for patients from the very beginning is to make sure you know exactly what kind of cancer you have and have the medical team write it down for you. And if you don't understand the terminology, ask questions. It's important for you to know, do you have a non-small cell lung cancer or a small cell lung cancer? Do you have a Hodgkin lymphoma or do you have a non-Hodgkin's lymphoma? Or if you have a renal cell cancer or a certain type of cancer, it's really important for you to know the name of that cancer, be able to identify the cancer. And that's important for several reasons. Number one, you're probably, or many people, go home and look up things on the computer, and it's important for you to be looking up the accurate diagnosis. So it's important for you to understand what the name of your cancer is. Secondly, a lot of people, whether it be your family or friends, are going to ask you what type of cancer it is, and it's important that you are able to identify the type of cancer that you have if you wish to share that with them. The other thing I really encourage people to do is get a copy of their lab report or their pathology report. And sometimes, you know, it's a long report and a lot of the words don't make sense. But if you keep that in your records, it's important to have so that you have the name of your cancer and the information. And if you need help, you know, deciphering all of that wording, you can certainly ask your medical team and they can help decipher all of that wording. But I always tell people to ask for their lab reports, ask for their records. It's okay for you to have them. Those belong to you. Also, it's important to talk about, you know, how the physician is maybe basing their treatment. What are they basing their treatments on? Again, physicians aren't just pulling these treatments out of the air. You know, they are basing these on guidelines. And we'll talk about guidelines and pathways in a little bit, but they are basing these on particular research studies and particular evidence-based standards. So they aren't just saying, oh, this sounds good. We do base those treatments on evidence. And so it's okay to ask your physician, what are you basing my particular treatment recommendation on? It's also important to talk to other people who have maybe your similar type of cancer, and not all people want to attend a support group, which is totally okay. But if you do want to attend a support group, it can often help you just commiserate with other people who are going through similar things and maybe get some ideas about how to manage side effects or what's working for them. And also just to have that support. And I think this year, especially, the online support community has been especially important for people. And we've learned a whole new way of providing support, particularly with Zoom and online conferences and different things. And so while those inpatient, I really appreciate in-person support groups most, and Lori can attest to that. I know that she comes to our support group, but I really appreciate those in-person support groups. But of course, this year we will take any type of support group, and sometimes Zoom is the best way to get that support. Next slide. So we talked about, okay, what type of cancer do I have? Some other questions that come up: what stage of cancer? What stage is my cancer, and what does that mean? So there's kind of a general sense of staging, stage 1, 2, 3, and 4 of cancer, but actually each cancer has a little bit different staging process. And so the stage of each cancer can be a little bit different. In general, we know that stage 1 is a more localized cancer, and stage 4 is a metastasized or a cancer that has spread outside of the primary site. But if you do want to know the stage of your cancer, that is a very good question to ask your physician, because it can also help you kind of understand where you are with your cancer diagnosis. We also talk about, well, what symptoms can I expect? Am I expecting to be short of breath with this particular type of cancer? Do you think I'll have pain? Do you think I'm going to have more fatigue, weakness? What kind of symptoms might I experience? And I'm not just talking about symptoms or side effects from treatment, but from the cancer itself. So sometimes people really like to know that, because it can help them understand on a broader level why they are feeling how they're feeling. We also talk about, what tests will you need? Have I completed all of my tests? Do I need more CT scans or MRIs or PET scans or bone scans or lab work? A lot of oncologists, before they actually see you for the first time, a lot of times want this workup done so that by the time you see the oncologist, a lot of this will already be done, and then they can give you a much more comprehensive recommendation about your cancer treatment recommendations. But, you know, along the way, you are going to have various tests. And so that will be something that is important to understand. How often do I get these tests? And why am I getting this test? And why am I getting a PET scan this time and a CT scan next time? It is always okay to ask those questions. We also talk about second opinions. So not everyone gets a second opinion. A number of people do, and that's always okay. No physician should be offended by you getting a second opinion. That's always okay to get more brains involved. Some people want to go to maybe a university type of setting. Some people want to go to Mayo. Or maybe somebody in your family or a friend has the name of a physician who they think you should go to, or they've had experience with. So sometimes a second opinion can really provide peace of mind for people. I had a patient the other day call me. We knew that she was going to Mayo for a second opinion, and she went through the process of getting the second opinion. And she called me the other day and she said, Shirley, I heard back from Mayo, and they said they would do exactly what you're doing there. And so, you know, I feel good. So I'm going to continue doing what I'm doing. But it really gave her peace of mind just to know that, yes, indeed, you know, somebody else outside of the institution took a look at this. They agreed with this, and they said, yeah, keep doing what you're doing. And that really brought her a lot of peace of mind. So again, not everybody gets a second opinion, but that's always okay to get a second opinion. And a lot of times your cancer center can help facilitate that second opinion if you wish to get that. Next slide. So choosing your healthcare team. I thought this slide was a little interesting, because sometimes I'm like, well, how do people choose their healthcare team? You know, that can be kind of a tricky situation. It's like, well, you know, how do you choose the healthcare team? Well, a lot of times the healthcare team is actually kind of dictated a little bit by insurance coverage, right? There are certain places that you can go, but that's not always the case. You know, sometimes people might go to a certain place because of their cancer type. Maybe a certain cancer center specializes in this particular type of cancer, or this particular stage of cancer, and so they go there. Or maybe the person is, you know, saying, hey, I really want to go to that cancer center because it's close to me and it's easy proximity and I don't have to drive far. Maybe the parking's easier, you know. And sometimes people have a very definite idea from other people they've spoken with that, hey, I really like the sounds of your physician. I would like to go to that same physician. So there are a lot of ways in which a healthcare team is chosen. And I think each person kind of has to decide for themselves, you know, what works best for you. And once you choose a healthcare team, it's important for you to feel comfortable with your healthcare team. So if you feel like you're in the right spot, that's great. If you feel like you don't click, then it is okay to change. And it really is dependent upon where you are with how you feel about things. Next slide. We also talk about the members of your healthcare team. So there are so many members of the healthcare team, right? And actually what's not on this slide, but I want to say it up front, and most importantly, don't forget about your primary care physician or your primary care provider. They are so important as part of the healthcare team because, of course, when you come into the cancer center, our team is going to be focusing very specifically on the cancer piece. So we kind of have this vision of like where you are with your cancer, but sometimes you need your hypertension taken care of, or your diabetes, or maybe your run-of-the-mill cold, or other issues, and the primary care provider can really take a look at that big picture. And so it's very important to stay connected with your primary care provider throughout your entire cancer treatments. Because sometimes our oncologists will say, really, we should have you follow up with your primary care provider on that. And some people will say, well, I haven't seen my primary care provider over a year. And I'm like, well, this is the time to go in and see them and reconnect, because they are a very important part of your team. But who are the other people who are part of your team? Well, your medical oncologist for sure is often the quarterback of the team if you're undergoing chemotherapy or immunotherapy or targeted therapy. Your nurses, there are several nurses involved, whether that's the nurse navigator or the chemo nurse. There are a lot of nurses involved, or the inpatient nurses. Surgeons, pathologists, radiologists, radiation oncologists. The dosimetrist is a person who works with a radiation oncologist, looking at and managing the dosing of your radiation. You see medical physicist on here too, and the medical physicist works very closely with the radiation oncologist to look at your treatment planning for radiation. So they're very important people. And of course, the radiation therapist, the one who's actually putting you on the in the treatment and going through the treatment, very important person. General practitioner, like I was just saying, social workers, they are so important to our teams to help people with different resources. Very important part. Next slide. We also have pharmacists and psychiatrists and psychologists and registered dietitians and plastic surgeons and rehabilitation specialists and home health aides and hospice care providers and clergy. Another one that is not on here, but I do want to add, is the financial counselor. Most cancer centers do have a financial counselor who is really helpful in prior authorizing your treatments, or looking at co-pays and figuring out sometimes, free drugs for people. And so the financial counselors do a lot of this background work that a lot of people don't even know don't even know about them, but they're doing a lot of the background work as people are getting treatment or about to get treatment. Also, I do want to put a plug in for nurse navigators, or in some institutions they're called clinical care coordinators, or at my institution it's a clinical nurse specialist. These are nurses who specifically help navigate you through the system, and they often work with all of the disciplines to help kind of glue everything together and to make sure the left hand knows what the right hand is doing. And so I think it's really important that you know who your go-to person is, because a lot of times there's that nurse navigator who you can call, and maybe the person doesn't know the answer right away, but they can get to the answer. And so I can't stress that enough, the importance of knowing who your go-to people are. Next slide, please. So how do you prepare for your doctor visit? A lot of you may have already been to several doctor visits, and maybe you're already doing this, but I want to reiterate the importance of writing questions down before you go to the doctor, just to organize your thoughts. Now, again, some of this will naturally unfold at the office, and so you might not have to go through every question because it's already naturally unfolding, but take a look at your questions and make sure that your questions are being answered throughout the discussion. It's also okay to record the session, but make sure that you mention that or ask that before you just turn on the recorder. Most people want to know if they're being recorded. I thank you, Annie, tonight for telling me that I'm going to be recorded. I appreciate that. Most people want to know that up front. Also bring a friend or a family member with you to take notes. I know there are a lot of restrictions right now with COVID. You know, some institutions are only allowing one family member or one person to be with you, but there are a lot of conference calls. There are people who can take notes, write things down, be a second set of ears. So that's really important too as you're preparing for your doctor visit. Also, make sure that you're telling your doctor and nurse all the medications that you're on, because some of these over-the-counter medications or herbal supplements can really have an impact and sometimes negatively impact the treatment. So it's important that you are very open and honest about what you're taking, because you know, they're not necessarily going to say, no, you can't take them, but we want to make sure we know what you're taking so that we know if there's any issue, we know the entire story. So I do want you to just be very open and honest with the team. And again, I do want to stress the importance of making sure that you ask questions. If there is terminology that you don't understand, or if things don't make sense, ask questions. Your nurses and doctors want you to be part of the conversation. They want you to be an active part of your conversation. So make sure that you're asking the questions along the way. Next slide. Other things that we can do, try to stay focused on what's happening now, rather than trying to make all the decisions at once. As I was mentioning before, we kind of need to take one step at a time. Even on that, you know, that first day that we give you all the information, you don't have to make your decision right at that moment. It's important for a lot of people sometimes just to take it all in, take the written materials that we give you, the information that we give you, go home, think through things, talk about things with your family, and then maybe make a decision. So you don't have to be pressured into making a decision immediately. And I think that's really important to remind people that they can have some time. I'm not saying I wouldn't take, you know, several months to make the decision, but it's important that you think through things and you don't have to make an immediate decision right away. And also, just in looking at this slide, I want to reiterate the importance of tapping into resources at the cancer centers that you're being treated at. You know, a lot of the cancer centers have various resources, whether it be social workers, financial counselors, acupuncturists, dietitians, the nurse navigators, the physicians. There's a whole team of people to help you. And also, I want to put a plug in for the organizations in the community, such as Gilda's Club, Breath of Hope Lung Foundation. I think of Open Arms of Minnesota, Susan G. Komen, American Cancer Society. There are so many organizations that we are really blessed with, particularly in Minneapolis. And I do want to encourage you to make sure that you tap into those resources, because those will help you along the way, making sure that you get information. And then also, so not only making sure that you get information, but different support services. And so that is always okay to do along the way. Next slide. And next slide. So making a decision, we're kind of getting, kind of transitioning into to treatments. You know, how are we making decisions about treatments specifically? Well, there are a lot of factors to consider. We've talked about your values and goals and the resources and things like that. Let's now get down to a little bit more about the treatments themselves. So one of the things is the goals of treatment, discussing the goals of treatment with your doctor. So a lot of times your physician will tell you at some of these initial conversations when they're making recommendations, whether or not this goal of this treatment is curative or is this palliative. And what does palliative mean? Palliative is a term that it means to alleviate symptoms, to extend life, to provide comfort. Also, what are the potential benefits of this particular treatment? What are the pros and cons? You know, if I do this treatment, what are we looking at? What if I don't do this treatment? What are the advantages and the disadvantages? And do the advantages outweigh the risks of the treatment? All of these things can unfold. Some people want to know this right up front, and some people say, nope, I can't deal with that quite yet. But if you do want to talk about it, these are good questions to ask. What about the type and severity of side effects? You know, am I going to have a lot of nausea? Am I going to be weak? What is this going to mean for my quality of life? We really talk about quality of life a lot when we are meeting with patients at the cancer center, because we want to know what people you know, what their goals are, but also the focus on their quality of life. What makes their life most meaningful to them? And we have that discussion all the time. And sometimes that changes over the course of treatments as things unfold and the reasons behind that treatment choice. And again, we kind of mentioned costs. Again, sometimes people are super concerned about cost, and that's an understandable concern. We talk about the financial toxicity of treatments and how that can impact people's concerns about finances. Again, there are a lot of resources. I can't stress enough that our financial counselors are doing a lot of background work to make sure that people can get their treatment, hopefully without too much financial toxicity. There are also resources in the Twin Cities area. I think of Angel Foundation. We use their financial grants a lot to help people offset costs. And it's not offsetting costs of treatments themselves, but offsetting costs of living expenses, whether it be maybe bills or groceries or gas or things like that. And so there are a lot of concerns that people have about cost, and I really want to stress that we do have resources. The financial counselors are super helpful in addition to the local resources in the Twin Cities area. Next slide. Okay, we talk about guidelines and pathways. I mentioned it just briefly a little bit earlier, but the focus again on the physicians are not just pulling these treatments out of thin air. You know, they're not just pulling them out of a hat. They are really looking at guidelines and pathways to guide them in terms of what type of cancer do you have, what's your stage of cancer, and what is the recommendation. So a lot of these guidelines and pathways, if you go to, you know, like the Community Cancer Center where I work, or if you go to the university, or if you go to Mayo, or if you go to MD Anderson in Houston, or to Sloan Kettering in New York, a lot of times patients will get very similar, if not the same answers, because a lot of these guidelines are followed because it's evidence-based. There have been research studies and research studies and research studies that look at the evidence and what is the recommendation for this type of cancer and for this particular stage of cancer to be able to give these recommendations to patients, and what are these approaches. Next slide. So an example of guidelines, you may have heard of NCCN guidelines. So National Comprehensive Cancer Network guidelines are very commonly used by most practices. And they really take a look at the specific subtype of the cancer, the genomic profile, the stage of cancer. And there are these panels consisting of all these cancer specialists, experts in psychosocial care and patients to help make these guidelines. They're developed based on what's known to work best for treatment. And again, looking at evidence, we're looking at research studies and putting all of that together. They don't usually talk about cost of treatment. That's not typically impacting guidelines. They're just talking about what works. They don't say, hey, this drug costs $50,000, which sometimes it does, but they're really focusing on more what are they seeing in these research studies. Next slide, please. Pathways, high quality oncology clinical pathways are detailed evidence-based treatment protocols for delivering cancer care to patients with specific disease types and stages. So sometimes pathways are used in some pathways I will see, where they talk about preferred drug choices. I don't see a whole lot with costs and things like that, but again, focusing on the research and the evidence-based along the way. Next slide. So questions to ask about the treatment options. We get back to, we were talking about what are your personal goals, but also what is the goal of treatment? Is this curative versus palliative? Why are you recommending this treatment? Are you basing this on NCCN guidelines? What are the benefits and risks? How can we prepare for and manage these side effects? Next slide. And then we get down to the logistics. How is this treatment actually going to be given? Is this going to be given through an IV? Is this going to be given by taking a pill? Is this going to be, what are the details? Tell me the details. People want to know how many cycles, how long does each treatment last? Is there a support group for me as I'm going throughout these treatments? So these are some of the logistics types of treatments. It's also important for you to know what number do you call if you are having side effects? What's your 24/7 number? There's a little card that I don't know if you guys can see this, but it's called When to Call the Doctor. And we use this at the cancer center where I work, and it's a 24/7 number, and it gives suggestions on, okay, if you, not suggestions, recommendations rather, if you have a fever of 100.4, not 104, 100.4 or greater, you need to call the office. And this number will roll over to the triage line or the on-call physician after hours. Or say your anti-nausea medication isn't working, or the pain medication isn't working, or you have new symptoms, worsening shortness of breath. Now, if there's something acute and really bad, of course, we want you to go to the emergency department, but sometimes there are these side effects of treatments, and people will say, well, who do I call and how do I get a hold of somebody? So it's important for you to ask, how do I get a hold of somebody, particularly after clinic hours? How can I get a hold of somebody at 2 in the morning or on weekends or holidays? How do I get a hold of somebody? And that's an important question to ask if they haven't already told you. Next slide. So we're talking about treatment options too. So what are our treatment options? Well, there are kind of 5 main areas, I would say. We talk about chemotherapy, radiation therapy, surgery, targeted therapy, immunotherapy. I'm sure all of you have heard of a lot of these terms. Next slide. We're going to start with chemotherapy. So this is a treatment that, of course, involves the use of drugs to destroy cancer cells. Chemotherapy was actually first discovered in the early 20th century. But its use in treating cancer actually began in about the 1930s. But new drugs and combinations of drugs have been developed over the years, and there are often, several lines of treatment. And over the years, there have been so many advancements with chemotherapy. I can even speak to that myself. I have been a nurse, an oncology nurse, for 26 years now. And when I started 26 years ago, it's so different in many ways because we've had so many advances, not only in chemotherapy, but in side effect management. I can't tell you how many options now we have for anti-nausea medications, and that has really developed over the years. So that is a great, great thing. Chemotherapy can be given through an IV, in pill form, injection, applied directly to the tumor. An example of being applied directly to the tumor, a lot of times people know about IVs or pills or injections, but there are some examples of directly applied to the tumor. 5-FU is a good example. It can come in IV form or oral form, but it also can be used in topical treatment for some skin cancers. So there are some things that can be put right on the tumor. I would say more commonly, though, it's IV or injection or pill form. And we also consider chemotherapy to be a systemic therapy, meaning it goes throughout the system. So it's a systemic therapy. Next slide. We also talk about radiation therapy. So cancer treatment that uses high doses of radiation to kill cancer cells and to shrink tumors. So at high doses, radiation kills cancer cells or slows their growth by damaging their DNA. So cancer cells whose DNA is damaged beyond repair stop dividing or die. And when the damaged cells die, they are broken down and removed by the body. So radiation options also have really, really advanced over the years. There are several types of radiation you may have heard of. We talk about fractionated radiation therapy, gamma knife or cyber knife, stereotactic body radiotherapy. I kind of think of them in 2 main categories. There's external radiation and internal radiation. So those are kind of the 2 main categories. And external radiation is delivered by a machine aiming high energy rays at a specific body area. And the treatments are usually done once a day over several weeks. Maybe it's 5 weeks, maybe it's 6 weeks. Internal radiation is also called brachytherapy or seed implantation. These radiation sources, such as seeds, ribbons, capsules, or liquid, are placed inside the body. Some radiation therapy for prostate cancer is a good example of this. They also mentioned in this slide, inpatient treatment may occur until the body no longer gives off radiation at a high level. I have to say, in the 26 years of oncology nursing, I have not seen much inpatient radiation. So in fact, I can probably count on 2 fingers the amount of times I've seen that. So I haven't seen a whole lot of inpatient radiation. Next slide. Surgery is actually the most common form of cancer treatment, and this can be used in combination or alone or in combination with other treatments. And surgery can be used in a lot of different ways, maybe to diagnose your treatment or to diagnose your cancer rather. So you may actually have to have surgery to get the specimen to actually diagnose the cancer. Sometimes it's used in staging where they take lymph nodes and determine if there's lymph node involvement. Sometimes surgery can be the treatment, so to stop the spread of cancer cells. So sometimes if maybe, as an example, you have cancer in the kidney, they go in and do surgery and remove that kidney. That's an example of treating the cancer with surgery itself. Sometimes debulking is another option with surgery where they reduce the tumor burden. So maybe they can't completely remove the tumor, but maybe it's pressing on something or causing issues on another area. And so they debulk that area with the hope of maybe shrinking it even further with radiation or chemotherapy. So debulking we see quite commonly. Reconstruction is another example of where surgery may be used to restore function or appearance of a body part. I think of breast reconstruction. That's a good example of reconstruction. So surgery can be used in various ways, and we see that used all the time. Next slide. So a couple of other therapies that we talk about are targeted therapy and immunotherapy, and these really have taken off, I would say, really in the last probably 10 years, and immunotherapy even more recently than that. So these are really hot items. So targeted therapy more precisely attacks cancer cells by targeting specific genes or proteins. So a lot of times when people have a biopsy or a surgery, we take that specimen and we send that specimen off to a lab to have it tested for certain mutations. And so if you have that mutation, then sometimes a particular type of treatment can address that mutation. And a good example of that would be an EGFR. Like if somebody has a mutation, an EGFR mutation in lung cancer, if they're positive for that EGFR mutation, then there's a specific pill that can target that mutation. Targeted therapy, though, can be given through an IV, a pill, or an injection. I've most commonly seen targeted therapy through pills, but there are a lot of ways to give that. Not all cancer cells or not all cancer types can be treated with targeted therapy because it really depends on if you have these specific genes or mutations. So not all cancer can be treated with targeted therapy. Next slide. We also talk about immunotherapy, and of course that is a very hot topic these days. You've probably seen commercials with Keytruda, Opdivo, Tecentriq. These are just 3 examples, but you see those even on TV. But what immunotherapy does is these are drugs that help the immune system recognize and attack cancer cells. So it's basically helping the immune system kind of do its job in a way. And so immunotherapies are usually given using an IV. And so immunotherapy is given in a lot of different cancer types now. And sometimes it's also given in combination with chemotherapy. So again, there have been so many advances because now we're not just doing just immunotherapy, we're doing it in combination with other therapy. Next slide. We also talk about palliative and supportive care. So palliative care is a term that is used that often is confused with the term hospice, but palliative care, I want to stress, focuses on providing patients with relief from symptoms, pain management, the stresses of a cancer diagnosis, and palliative care can really start at the very beginning of a cancer treatment. A lot of hospitals have palliative care teams, which are basically teams that really can add an extra layer of support for patients who are going through treatment and managing side effects. So people often confuse palliative care with hospice care, but it's not the same thing. And people who are getting palliative care can still be going through active treatment. So hospice care usually is started when patients are no longer getting active treatment for their cancer, but with palliative care, supportive care, you can be getting palliative care from the very beginning throughout. And so a lot of times people do see a palliative care physician. at the very beginning to help with those symptom managements, and sometimes to talk about end-of-life discussions, but a lot of times it's to kind of talk about the big picture and particularly side effect management. And it can really, the second point in the slide brings us up to improving quality of life. The point is to really try to improve quality of life as people are going through cancer treatments. I want to just stop here for a moment because I'm only hearing myself speak. And so I just want to check in, and if people want to unmute at all at this point, are there any questions along the way? I know I've been talking and talking, but it feels like I'm talking to myself in my dining room. So is there anybody who has any questions along the way? We will certainly take questions at the end, but anything that you want to bring up or have questions at this point? Okay, well, I guess we'll continue. Next slide. All right, questions to ask during treatment. So some questions you might want to think about as you're coming into your clinic visit each time. The symptoms and side effects that are affecting me the most. Think about, if you're having any issues with your treatment, whether it's immunotherapy, targeted therapy, chemotherapy, radiation therapy, anything that you're undergoing, talk about those side effects or those symptoms that you're experiencing. And again, write those things down so that when you do come in and talk with your physician or the nurse practitioner or the physician assistant or the nurse navigator, you can say, hey, this is the trend that I'm seeing. What's interfering with your life? Because a lot of times we can manage the medications better or give you something differently to help manage those side effects because we do really want you to have quality of life. Sometimes you might ask, could complementary therapies or supportive palliative care help manage my symptoms and side effects? Can you refer me to a palliative care specialist? It's important that you understand this terminology so that if you do have questions along the way, you can ask those at any time. Next slide.
Sorry, I moved away from it.
No problem. All right. And again, what I was saying too is track your side effects. Is your nausea worse in the morning or is it worse in the afternoon? How is your pain? When you take 2 of the oxycodone, does that help or, are you getting any relief? So if you can look at trends and write things down, or if you don't want to write things down, have a family member, your caregiver write things down, because that can really help the physician or your medical team make changes when we kind of know the trend of things. So look at the trend and write those down and tell us what's going on. Next slide. The other thing that I do want to bring up tonight as part of the whole treatment, making treatment decisions and discussions, we talk about important documents, and this is important not just for people who have cancer, but actually everyone. We talk about these documents such as living wills or advanced care directives. What a healthcare directive is another name for it too. What kind of medical care would you want if you could not speak for yourself? We also talk about durable power of attorney, which names a person who can make health decisions for you if you're unable to make them for yourself. Some people think, oh, I've got to have a lawyer for that. You actually don't have to be a lawyer or need a lawyer to do some of this, but it is important that you do look at this paperwork. And again, I'm not just saying for somebody who has cancer, but all of us, it's important that if you cannot speak for yourself, is there someone who could speak for you and represent your values? Next slide. And kind of going on from that, financial power of attorney names a person who would make financial decisions for you, not only in your home setting, but say you needed to go to a nursing home or some type of facility, making those financial decisions, for you if you couldn't speak for yourself. Some resources for this: social workers are really good resources. We have a wonderful social worker in our cancer center who has will sit down with people and talk about healthcare directives and give them resources. Also, I want to put a plug in for Cancer Legal Line, which is a great organization in our Twin Cities area that provides free legal service for cancer patients. And they will go through these legal documents with you with healthcare directives, durable power of attorney, financial power of attorney. I had a patient several years ago who had a really, really messy divorce and a really bad custody situation. And they really helped her through that as she was dying from her cancer. So they can do some really great work, and I really want to put a plug in for them because they have helped so many of our patients with free legal service. So Cancer Legal Line is the name of that wonderful organization. We also talk about DNR orders, or so that you may have heard of DNR, meaning do not resuscitate or allow natural death or do not attempt resuscitation. It's important for you to talk with your loved ones about what you want and what you would want in the event that you were in dire need of needing something, and or if you couldn't speak for yourself. So these are important conversations to have, and these are especially important when you are able to have them. You know, you don't want to wait until a crisis situation to have them. It's important to talk about those things now. And again, I'm not just talking about people who have cancer. I'm talking about any of us need to have that discussion. We also talk about a will, who states who will receive your money and belongings. And again, that's all part of what some of these legal services and Cancer Legal Line can help with that as well. Next slide. So caregiving. So some of you may be caregivers. You may not be the patient, but you might be a caregiver. And that caregiver word can really be a fluid word. So sometimes you're a caregiver, sometimes you're a spouse, sometimes you're the friend, and then you go back into the caregiving mode. It kind of depends on what's going on with the person's cancer. And it's important for the caregiver, especially if you do have a primary caregiver, to be part of these discussions and to be part of that decision making. And remember, again, you don't have to make all decisions at once, but the caregiver role is a really, really important role. And it gives people a sense of peace to know that there is somebody who's part of that decision-making process. So taking time to ask questions, think through the steps, partner with your medical team, but also know what the wishes are of the patient, because that can be really important for you to help with decision-making if you've had these open conversations. I also can't stress enough the importance of caregivers taking care of themselves. I think a lot of times people get into this caregiver role and they're doing so much to help other people that they forget to take care of themselves. And it's hard to take care of other people if you're not taking care of yourself first. Next slide. So we talk about, again, self-care, and I just want to reiterate that. And I think I covered all of these, so next slide. All right. So taking the next steps. So be selective on where you find your information. Use proven, reliable resources. You've probably heard this over and over, right? A good example of a really good, reliable resource that we use very frequently is an ASCO website, actually, the American Society of Clinical Oncologists. The website is cancer.net, and it gives really credible sources to patients who are undergoing chemotherapy and radiation therapy and knowledge about their diagnosis, because you don't want to just use Dr. Google. It's really important to look at credible websites. Another one we use is chemocare.com. Gilda's Club also has great links to credible websites, and we'll see that at the end of this discussion too. But it's really important that you're not just kind of willy-nilly going to these, random sites. It's important that you use really good, credible websites so that you're getting credible information. Also, I really want to stress the importance, and I mentioned it before, but I want to mention it again, that remember that your path is unique. Just because Billy Bob over there is having difficulty with that type of chemotherapy doesn't mean that you're going to have difficulty with that. So I want to remind each of you that each of you is unique. Each of you has a particular way of responding to things. And so your experience may be very different from somebody, who you might be comparing yourself to, but it's important that you remember your path is unique and individualized to you. Also, I really want to stress the importance of choosing a healthcare team that you are comfortable with. Make sure you are able to partner with your healthcare team so that you're able to openly communicate with the healthcare team. And if you don't feel comfortable with your healthcare team, maybe it's time to change that healthcare team, because it's important that you are able to ask questions, that you have go-to people, that you get your questions answered in a timely manner, and that you feel comfortable and confident in your medical team, because that will help you overall psychologically cope with everything that you're going through as well. Next slide. So we also see here the, I was talking about credible resources. Well, these are some credible resources. So this is all through Gilda's Club. They talk about the Cancer Support Helpline, the Cancer Experience Registry, the Open to Options, these Frankly Speaking About Cancer series. And actually, this is part of this Frankly Speaking series. So Gilda's Club does a really great job of having various diagnoses that are addressed and treatments and different things. And so I really encourage you to look at all of the resources that Gilda's Club has to offer. Again, we also have so many wonderful organizations in the Twin Cities area, and I mentioned some before. I'll re-mention them again. I talked about Cancer Legal Line, A Breath of Hope Lung Foundation, American Cancer Society, Angel Foundation, Open Arms of Minnesota, Pathways, Susan G. Komen. There are so many wonderful organizations, and I want to stress to you that these places have a lot of great resources. Also, your cancer centers have a lot of great resources. A lot of cancer centers have support groups and support services that they can really connect you with as well. Next slide. The Cancer Experience Registry, this again is part of Gilda's Club. Annie can probably speak better to this than I, but it is a research survey to identify and understand emotional and social needs that are unique to the cancer experience. And so if you do want to participate, I think there are links through Gilda's Club where you can participate in that Cancer Experience Registry. Next slide. And this is just the timeline for that. Oh, here it is. Yeah, this is the cancerexperienceregistry.org. So if you are interested in going to that, they have a lot of resources through that. Next slide. Okay, and then also talking about being an advocate for, there are a lot of people who maybe want to talk about their experience on these different levels, and there's so many ways of becoming an advocate. They talk about the grassroots movement, but really being an advocate for great cancer care, and the cancer support community can help with that. And next slide. And there's also and through this link, mylifeline.org, it's an interactive blogging and update type of series with a helping calendar, discussion boards, care coordinators, privacy controls. I also think of Caring Bridge as kind of another example of this.
It's similar.
Yeah, kind of a similar thing. Sometimes people say, I don't want to call every relative who wants to know, what's going on. Sometimes it's easier to put it on a site. And so this is a good example of where it can be a localized site to help you kind of manage all of the calls and all of the support that you have coming in. And next slide. Okay, and we have come to the unmuted portion of this talk. So go ahead and unmute yourself.